Assalamu alaikum wa rahmatullahi wa barakatuhu. Ahlan wa sahlan. Welcome each one of you to this very important maternal mental health awareness event. It's a pleasure, as always, to see so many familiar faces online and all the new ones here that have joined. Alhamdulillah, the fact that you are here for seeking awareness and knowledge on such an important topic makes me so proud of each one of you, right? Taking out time to see this, even if you're watching the recording, it's a very, very proud moment for me. And it shows that you, as mamas, at whatever stage of uh, maternal journey you're in, you give importance to this. That is why you're here to listen to me today. So first of all, let's begin with the dua. Let's purify our intention. Let's make our intention very clear that we are here for the sake of Allah subhanahu wa ta'ala, that we learn and that we heal and that we go back with the knowledge that help us to be better mothers for this ummah, inshallah. So the dua that I always recite in the beginning is Allahumma anfa'na bima 'allamtana wa 'allimna ma yanfa'una wa zidna ilma. May Allah make this knowledge beneficial for all, and we're able to help ourselves and the people around us, inshallah. I will begin with a brief introduction about myself and why did I choose this event. If you guys remember, those of you that were in part of this group for a while, that I did do a little poll to see what was the next free event that you guys wanted. And the majority was, well, it was a very close line between birth and postpartum, but the majority was postpartum. And then subhanallah, again, it's all connected, and then Allah makes ways and it gives me ideas and stuff, that it so happened that alhamdulillah, I came across the fact that I didn't even know, I don't put these things on my calendar, that it is the Maternal Mental Health Week this week from May 5th to 11th. And I was like, there you go. That's my answer, that most of you are postpartum and looking for the right support in postpartum. And you could be postpartum 6 years later as well. So any of you that have had, like for me, for example, my daughter, mashallah, Allahumma barik, is 6 years old. So I'm a 6 years old postpartum mom, right? Doesn't matter what, like you could be postpartum one day, you could be postpartum a few years. You're always a postpartum mom if you've just given birth. And also for those moms that have uh that are in the pregnancy journey, about to give birth, in the nursing stage, or even those holding space for those that have lost their babies through miscarriages, infant loss, stillborns, and even those that are struggling with fertility. All right, so when it comes to maternal mental health, it's about all and for all, every single stage of motherhood. Let me start with introducing myself. A lot of you already know me, so you can just, kind of just sit through this part because it would feel like something I'm repeating and again. My name is Hafsa Qureshey. I am a birth professional as well as a lactation professional. It's been 11 years since I'm in this field, alhamdulillah. I became one after my own journey. So was a mom like each one of you. I had a very traumatic birth experience with my first C-section, which was very, very traumatic. And that's when I realized that this is not how it's supposed to be. It felt that it was against the fitra. It felt just not right. And I started my journey of seeking light, empowerment, knowledge, support for my next birth. And alhamdulillah, it's going to be 11 years in 2 weeks' time that I had my empowering VBAC, Allahumma barik, in 2013. And then there was no looking back. Once I achieved even before I achieved my VBAC, I was shocked with the amount of knowledge and misguidance that moms, it's just so much wrong information's out there. The lack of support, the lack of the right knowledge, all of that. So I realized that how much as a mom I needed to reach out to other moms. And then of course, alhamdulillah, I am based in Kuwait, originally from Pakistan, born and brought up here in Kuwait. I will be in Pakistan, inshallah, if God wills, next month. So I started to educate myself and become a professional, alhamdulillah. And you can see my qualifications on the screen. I'm not going to read through them. It's too many. And again, we're always a student. I'm also still a student in making sure I educate myself more and more to be able to help each one of you more and more. So that was a life-changing moment for me, and then the rest is history. One of the trainings I did was the Lamaze training back right, it was at COVID. So around the time when COVID was happening. Um, and it was this post of Lamaze that you see on the left side of the screen that popped up on my feed. And I was like, yes, definitely. I have been taught and I am qualified to give the right support to moms when it comes to mental health. And what better time to do such a topic and to teach you guys, to support you guys, to hold space and the awareness. So the purpose, the intention from this online event is for us to realize how important this is, first of all, to recognize what are the signs and of course, to find healing methods and ways that can work. And then, of course, work on ourselves, give ourselves priority because no one wants an unhappy mama, right? You cannot take care of those under you if you are not mentally okay. All right. And at any stage, or rather at all stages of our maternal journey, we do face ups and downs, right? So it is very important that we keep it in check about our mental health every time and anytime we can, inshallah. Okay, so I am going to do a little icebreaker activity with you guys. So if you want to scan the code that you see on the screen, or I am going to forward a link in the WhatsApp group that you all are in. Okay, you can use the same link. Okay, there you go. And I just want you to tell me and show me rather what part of, let me send it in this chat as well. Hang on. Where you are at, you might be more than one, but just choose one. Where you are at in your maternal journey. Okay. Just gonna open my Mentimeter to be able to shoot this. And screen. Just so I know what is our audience like this morning, or rather afternoon here. Okay. Okay, so we have most of you are pregnant, nursing, or postpartum. Some of you are planning for pregnancy. Some of you are here for knowledge. Some of you have faced an infant loss. And then there are some of you with older kids. So most of the audience here right now is pregnant. Let's see. I'm going to give you guys 2 minutes more to answer. You could just go to menti.com and use the code that you see on the screen, or just the easy method is to join using the link I've sent in the WhatsApp group or in the chat of the WhatsApp. All right, that gives me a good thing. I'm just gonna take a screenshot of this. so that I know what our audience was like. Okay, thank you. Jazakumullah khairan. Let's get back to our presentation. Okay, so what are we going to cover today? Inshallah. So the summary of all the main points that I'm going to cover today, inshallah, is basically introduction so that we understand the definition. What exactly is maternal mental health? What are the categories? How to recognize it, importance of this maternal mental health and mental health in general. Okay. How it impacts us during pregnancy and birth, and what can we do to avoid it? What can we do to rather help it, not exactly avoid it? And then, of course, postpartum is the most impactful one. And I'm going to give you some facts and figures as well. And then, of course, we are going to talk to our moms who've faced the infant loss and then end with a few activities. I do have 2 or 3 activities happening, so stick around. Most of them are at the end, but I do have some professional quizzes coming up well, one professional quiz coming up in the middle as well. All right. All right, so at any point you have any question, feel free to use the chat and ask your question there. I'm not going to answer it now during the class unless it's directly relevant to what we're talking about right now. I will, inshallah, answer it at the end. So let's start with what is maternal mental health. When we talk about maternal mental health, what is it exactly? And especially coming from the societies that I grew up in and the cultural norms and everything, if we don't recognize it correctly, if we don't understand, and if we are not aware, it is not possible for us to be able to help. So the correct recognition, the correct diagnosis, or the correct definition needs to be very, very clear. So it is basically your emotional, psychological well-being. You need to be okay emotionally, mentally during pregnancy, birth, and of course, postpartum, right? It is a spectrum. So there is not one definite that this person is okay, this person is not okay. There is a gliding spectrum and a scale, right? And there are different conditions that one can face, right? Including, but of course, not limited to depression, anxiety, PTSD, especially after a traumatic birth, right? Of course, OCD, right? And then, la samahullah, may Allah protect. If these things, or if it just gets worse, it could even result towards psychosis as well. And this, why do we need awareness on this? Why is it so important? Because you as a mom are now responsible for these little children that you need to take care of. And if your maternal mental health is not addressed, healed, corrected, right, it will have a significant impact on your ability to function, how you bond with your children, your babies, right? Overall family life, overall quality of life, right? So it is not just the well-being of you, because it's not just you. A mom is a whole household. It's a whole community, right? You are the take care cares of these children of this ummah, right? So it is the healthy development of your family, your children, as well as their stability and their well-being overall. This is why we are hosting this event and doing something specific about maternal mental health. Okay. Now, what are the common conditions that we can hear about? There is, of course, pregnancy anxiety, which is very, very common. And I want all the pregnant mamas, because that's, I think, majority of you here right now. I want you all to recognize and understand that the changes of our hormones, all of this can trigger this. And don't feel like, oh my God, why am I facing this? Why it's happening to me? No, it's very, very possible that it can happen. It is common that it can happen, right? But the key point is not why is it happening, but rather recognizing it and also making sure that we do our part to get the right support and help that we need. It can be the worry, fear, the change, right? The uneasiness, the discomforts, right? Because pregnancy itself is a whole roller coaster journey, okay? And if there are any ups and downs, any common discomforts, it can itself impact not just us physically, as well as mentally also. And then, of course, it's a whole new responsibility. I always tell my mamas when I'm teaching them childbirth education classes that the moment the baby is born is not when your responsibilities as a mom start. No, the moment you know you've conceived, now you're responsible for taking care of this child. Whatever you eat, you drink, your nutrition, your exercise, your decisions, your any tests, how much you're exposed to ultrasounds, what decisions do you take for labor, birth, all of that. You are mas'ul. You are responsible for all of this now. This is part of taking care of this baby. Okay? And of course, at any point you're feeling anxiety and not yourself, and we will recognize, we'll talk about the signs. What is signs of anxiety? It is common, like I said, and it can be managed with self-care support and if needed, even therapy. So here today, I am going to normalize the word therapy or seeking mental health support as much as possible, if and when needed, and removing the taboo on it, right? So that you mamas get the support you need, and then you look around you and see anyone around you that you could think that possibly is also suffering in silence, you can be the hand to reach out and give them that support and guidance that is needed. Okay, so the key thing is you all understanding that you are not alone. And then, of course, with after pregnancy comes birth. Birth itself is the big day. And Allah subhanahu wa ta'ala has given us this whole beautiful 9 months to prepare for this big day. So birth itself has its fears. And there is actually a term used for birth fear known as tocophobia, right? It is the fear or anxiety related to birth itself. And it can be from mild to extreme phobia as well. And definitely different factors will trigger it. Again, it is managed by education, and this is my role to educate you. So inshallah, towards the end of the class, I will let you know how that is possible. And therapy, and of course, exploring your birthing options and making those informed decisions. And then postpartum depression is another common one. It can affect your it is triggered maybe by the birth event itself. It's triggered by, again, the shifting of the hormones once all over again. It can impact the the bonding with your baby. It can impact your breastfeeding journey. A lot can be happening here also. And I feel this is the most common time where a mom needs support, and this is when she receives the least support. So here is what we are going to change this, right? We're going to spread the awareness, and we're going to help change this, inshallah. Okay, again, here therapy and even medication can help here. Okay, and postpartum depression can even be more worse for those that have experienced an infant loss. So we need to understand and empathize and be there. And I'll teach you how to support people around you, or even if you have experienced an infant loss, what and how can support help you. Okay, so I'm going to read through these. This is from the Lamaze website itself, right? This is what we are told. So these are the common symptoms at any point. So I just want you to close your eyes as I'm talking through this. I'm going to read through this, okay? I'm going to, at any point, depending on where you are, you feel any of these things, just make a note for yourself and promise yourself that I need to do something about it, okay? So, are you facing any of this? Just close your eyes and listen to my voice. No need to read on the screen. I will read it to you. So if you are pregnant or postpartum, the common symptoms of depression during this stage could include anger, sadness, irritability, guilt, lack of interest in the baby, changes in eating and sleeping habits, trouble concentrating, thoughts of hopelessness, and sometimes even thoughts of harming the baby or herself. If you face any one of these, make a note of this. All right? So this was depression. You need to make a note that if I'm facing any of this and I'm pregnant or I am postpartum, I need to do something about it. Now, the next one is anxiety. Anxiety is different to depression. What are the common symptoms? Again, keep your eyes closed, listen to me, and recognize if you have been feeling any of this. Extreme worries and fears, often over the health and safety of the baby. Panic attacks, shortness of breath, chest pain, dizziness, a feeling of losing control, numbness, and tingling. These are symptoms of anxiety. If you have faced or feeling any of this, make a note of this. You could be facing anxiety. Okay? The next one we'll talk about is OCD, obsessive compulsive disorder. Again, I'm going to talk about the symptoms. Close your eyes and think, is this what I'm feeling? If yes, make a note. So, what are the symptoms of OCD? Repetitive, upsetting, and unwanted thoughts or mental images, obsessions, and sometimes need to do things over and over, compulsions, to reduce the anxiety caused by those thoughts. We are not fixing anything right now. We are just recognizing and understanding and addressing this. The next one we're going to talk about, which is something I have personally experienced. So this is very true, and it is called PTSD, post-traumatic stress disorder. Perhaps you went through an event in your life. It could be birth itself. It could be anything that has left an impact on you. Okay, so what is PTSD? The common symptoms are, so this is often caused by a traumatic or frightening childbirth or past trauma. Symptoms are flashbacks of this trauma, feelings of anxiety, especially when you have these flashbacks, and the need to avoid things related to that event. Maybe not talk about it, maybe lie about it, maybe not visit the space of it, maybe not avoid it completely. Walk away from the people involved around that event. That is called PTSD. If you have faced this, a special hug to you because I can relate here. All right. And then, of course, there are more mental health conditions such as bipolar mood disorder. And again, it's important to recognize it. Don't feel ashamed if you are falling in any of these categories. It's just like, when we get sick with a cold or a flu or any other illness and we go and see a doctor, depending on the severity, understanding and knowing what is wrong with us is the first step. Okay, so this part is extremely important. What are the common symptoms of bipolar mood disorder during pregnancy or postpartum? This includes low and high phases, right? The low time is called depression and can appear as severe depression. And the high time is called mania or hypomania and shows symptoms of euphoric, elevated, expansive, or even irritable mood, which has increased energy, racing thoughts, frenzied speaking, decreased need for sleep, grandiose thoughts, restlessness, quickly changing topics and conversations to things that don't relate, impulsive or poor judgment. All of this, even one of it, could signify as a bipolar mood disorder. And again, there is nothing wrong with it. It is all very treatable if you intervene and fix it. And then, of course, la samhallah, the most severe of it all is psychosis. May Allah protect each one of you, but it is there, and women are facing it. And it's important that we recognize it, if not in ourselves, inshallah, then look around and see, reach out to anyone before things get really bad. Okay? Seeing what is psychosis? So seeing and hearing voices or images that others can't, hallucinations, believing things that aren't true, and distrusting those around them, confusion and memory loss, seem manic. Immediate help and care is needed for this condition because it can result in towards suicidal thoughts as well. Okay? It is very important that any of these symptoms, if you're facing them, please do not suffer in silence. Get the right support that you need. Okay? There are so many mental therapists out there. So this is the facts. Do not suffer in silence, exactly what I said. And these are the statistics, right? There are so much information you can gather, but I've summarized it into more concise for us to understand. But I just want you to understand you're not alone. 1 in 7 moms. So how many of you are of us we are here? We're above 50 people are online right now, right? So 1 in 7 mothers. I'm just doing some quick maths. So basically, at least 7 or more of these moms would have experienced depression or anxiety during pregnancy or postpartum. And that's a huge number, right? Imagine if all the women around us, and these are evidence-based statistics and facts, right? And it's estimated that around 15 to 20% of pregnant individuals and moms face some sort of mental health issue, mostly postpartum, but it can be in pregnancy as well, related to birth, PTSD. It can be related to events not linked with pregnancy and birth, but get triggered or come back as flashbacks. And this can impact your birth. And this is why I always tell my moms who take classes with me and I work with you in the debriefing process, right? Because unresolved emotional trauma from any past event as well can actually impact and prolong your current pregnancy and birth and your labor. It can prolong your labor, especially the hardest stage, which is known as the transition stage. Okay? And then if it's left untreated, impacts your well-being, the well-being of the baby itself, right? So early detection and getting the right support and treatment is very, very important. All right. And this is why these awareness events are happening. So these are more statistics I put up there. So women with PMAD. So 1 in 5 women face some sort of prenatal mood anxiety disorder. And that's even a bigger number than 1 in 7, right? This is a different study. Of course, it can change by the dynamics of the country and places, right? But it includes everything from all that I just spoke, all the symptoms that I talked to you guys about. Women hiding their symptoms, right? 7 in 10 women will hide or downplay the symptoms. Just listen to this again. 7 in 10 will hide or downplay these symptoms. That is 70%. This is sad. This is wrong. Why do the women feel the need to hide or downplay these symptoms? This should not be happening. This is what we need to change. Because it will impact you, mamas, directly. It will impact your children directly. It will impact your family directly. It will impact your partners directly. So any of the husbands listening to me now, check in with your mother, sister, wife, and women around you. Because see, this is a huge number. And without understanding support and treatment, these mental illnesses will have a devastating impact on the women affected and their partners and their families. And no one wants that. So let's change that. So important. Exactly. This is wrong. We need to change this. We need to stop thinking of dismissing, rather. We need to stop dismissing the importance of the mother's mental health. And the prenatal mood disorders affect the entire family. Many people don't even realize that it can even impact your partner. So even 1 in 10 dads, so I'm holding space for the fathers here as well, they get impacted also. And then the women that have faced infant loss, miscarriage, stillbirths, even infant losses. As a doula, this year, I can count at least 4 to 5 moms that experienced losses. And 1 week was especially hard because there were 2 in the same week. It impacted me. I can't even imagine how it impacted the family. I had my processing and healing to do, thanks to my fellow doulas. Some of them are online right now. I love you guys for the sistership we have, the support we have for each other. So even you mamas need the support. Do not suffer in silence. Because miscarriages are something that is very common, yet something that is just brushed under. It is a very common. 20 to 25% of pregnancies will end up in a miscarriage or stillbirth. Why is it happening? Instead of looking for answers, I'm not here to give you the answers. This is not the purpose of the event today. I'm here to recognize that if this is happening, it is impacting this woman as well. Just because she's not holding a baby does not mean she's not a mother. So in addition to grief, many of these women will have not just the loss grief, in fact, the postpartum depression part as well. So imagine that support that this woman needs. Is she getting it? Does she know where to get it? Is she recognizing it? She needs it. Right? It's very important. And even giving birth to a preemie child or having a child in the NICU can also take a huge toll on your maternal mental health. So please, please, please recognize this. Seek support. Once you find your ideal therapist, have them a phone call away. Have them as soon as possible you can reach out. And with everything happening in the world, right? All the traumatic events we're seeing unfold in front of us, I feel each one of us need therapy. And there is nothing wrong in seeking that. Let's remove the taboo from it and let's normalize it. The more we learn about it, the more we talk about it, the more we will spread the awareness of it. Because you mamas and your babies matter a lot. Okay? In pregnancy, what can you do to help your anxieties and all mental health? First of all, do not go into your pregnancy without knowledge. And believe me, regardless of how the birth happens or what happens, just having support, someone to turn to, having the right knowledge of what to expect, how to deal with common discomforts can make a huge difference. So please, I beg you, educate yourself. This is an investment much more important than buying that crib or planning that reception or, I don't know, investing in the most expensive stroller. No, this is important. You investing in childbirth education classes. Surround yourself with support group. My childbirth education classes come with countless support groups. Honestly, I've lost count itself. So some of my moms are online right now. Do you want to count and tell me? Or at least testify, right? You guys know what my support groups are like. And you guys know how amazing these support groups are. They're for me, honestly. I mean, I started so many of my support groups first for myself. And now they're beautiful communities We grow together in these support groups. We know where to reach out. At any point, there are little ups and downs, and we come together. So there's one mom whose child was not doing so well, right? We came and we all held her together. Thank you, Zahra. Lovely to hear that. And Zahra's just one of my, she just joined one of my recent groups, and her saying that means a lot, right? You will have access to mentors. I'm not calling myself a huge, amazing mentor. I'm still learning. I'm still trying my best. But if I can be of a small support to any of you, alhamdulillah, perhaps you would be a support to me. We don't know. Just know that in pregnancy, we need this. It is a stage of life you should not be doing alone. Always remember that. Thank you, Hayati. Sana saying the support group feels like a safe space. Exactly. We all need a safe space. And then if you need, like I said, have your therapists debrief weekly. All right. Get the right support that you need. And the first class that I teach in my classes, I tell you guys how to do your emotional roller coaster at a weekly stage and learn from it and hold for it. And of course, do not ignore any of the mild symptoms that we talked about. Reach out to me, right? My mamas know that. Of course, I mean, mashallah, in this group, there's over 700 moms. I cannot answer to 700 moms, but yes, if you have signed up for my childbirth education classes, I am there to support you as much as I can, inshallah, in this world and hereafter. If you feel you're not eating well, you want to be alone, you're irritable for no reason, you're crying more, you want to be in the dark, you're not taking care of yourself, these are worrying signs. I don't want my mamas to suffer this way, right? Please do not suffer in silence. Prioritize yourself. Women sacrifice themselves too much. Give yourselves priority. Do some things that you enjoy. And I will tell you to do that because that is going to help your labor at the end of the day as well. Remember, we want things that release that oxytocin. So doing things that you enjoy. Do a small weekly pampering, something very small. It could just be soaking your feet in some Epsom salt, right? Something small that you did for yourself, and believe me, you'll feel good. Maybe just a skin routine, all right? Because you matter. You give priority to yourself, and that is important. Oh, thank you. I was just reading the comments by all these lovely mamas of mine that are here. Thank you so much, Sana, Arwa, Bushra, Hayati, Maria, mashallah. Lovely to see you guys online after a long time as well. Atlas, you're here as well. Jazakumullahu khairan. And then, of course, find peer support. So sometimes you don't need like an elder mentor or someone. You need someone to support you at your peer level, okay? Join your support circles. There are support circles for as a group one. There are support circles for breastfeeding. There are support circles for any sort allergies the mom is facing, baby wearing. There's so many. There's a whole list. As I always send after our classes are over, a whole list of support groups that you can join. Okay, join these online sessions. These ones are open to the public. And then for those that have taken classes with me, I do specific ones for you guys, especially. What you need is non-judgmental support. Every pregnant mom needs that. Because knowing that women, all of us are in the same boat. You're not alone, right? You're not the one suffering from it alone. You can relate to each other. That itself is a comfort. I remember when I started my pumping group, 2 a.m., I have to wake up, and if I'm pumping, doing my middle of the night pump, and I would just message in the group that, you know, like awake, pumping, something like that. And then I would hear all these moms messaging again in the group, yes, we are pumping or breastfeeding too right now. And that just warmed my heart that there you go, I'm not alone. Or if I ask a random question, I would get an immediate reply. This directly helps us to get that right support that we need, right? For birth, how to reduce any anxiety related to birth. Very important. First of all, of course, which I just mentioned, knowledge. Educate yourself. Make a solid birth plan. So please join the classes. Writing a birth plan is part of these classes. So you know exactly what you're doing. And about the birth plan, it's always first for you and then for any other part of your birth team. Try and hire a doula. If not in person, at least someone virtually. Finding a supportive care provider, either a doctor or a midwife, someone who is on board as much as possible, someone you've shopped for. I had to change 18 doctors before I could find some that was somewhat, the same vision kind of. But again, the decisions were mine. This helps us with the confidence. The knowledge gives you confidence. And have support for your birth. Do not go into your birth alone, please. Okay, and for those of you who don't know, some of you are here for the first time, what do doulas do? Doulas are, again, not your main primary birth attendant, right? They provide emotional, informational, physical support, or even if needed, virtual support before, during, and after birth for women and their partners, right? Doulas and family members work together as a birth team, ensuring that as much as possible of the birth plan is followed, okay? It's important to have a family member and a professional such as a doula, because doulas are trained and experienced in providing labor and birth support. Okay, so they will give you the information that you need, the right information, because Dr. Google, I do not like. And this is the first advice I tell my mom, stop Googling things. Get the right evidence-based information to make the right informed decisions. And that really helps at the end. And then, of course, any point you would need any resources or have any questions, you'll get your answers. Of course, emotional support, relaxation techniques, encouragement, your cheerleader. Your doula is going to be your biggest cheerleader. And then making sure that your birth environment is protected. Communication, she will help you with the communication as well, right? Help you how to form that dialogue, how to doctor shop and everything. Support you, remind you how to make these informed decisions. She cannot make the decisions for you, but guide you towards making an informed decision. And then, of course, how to advocate, to stand up for yourself. And then those are the doulas in person, they will physically help you with pain relief strategies, with walking and position changing, breastfeeding, so anything that you basically need. Believe me, the birth I had with my doula was one of the best births and it really made a difference. So yes, for your mental health support, having a doula will really help. And then postpartum. I liked this, and it is from Connect the Dots, from related to this event, the Maternal Mental Health Week. The mother-child bond begins with mental health. It's a very deep quote. I want you to read and think about it for a moment. The bond between the mother and the child begins with mental health. How many of you can relate with this statement? I can. I had a very traumatic experience of a C-section, and then I had 2 amazing VBAC births. And I know when we talk about this bond, I remember not being able to immediately bond with that traumatic birth baby. He was my baby, but the bond was not the same as it was when I was mentally in a better place and when I had the right support, guidance, and an empowering birth experience. So yes, this is how important your mental health is, because it will directly impact your bond with your baby. So make sure to ask yourself, am I okay? I'm asking you, are you okay, mamas? If not, please reach out, talk, find out. I'm not a mental health therapist myself, but there are so many sources out there. I'll be, inshallah, in the group. I will definitely be sharing some of them. One of my favorite questions just popped up, although I want to answer all the questions at the end. But yes, you can definitely have a VBAC birth, vaginal birth after a C-section. I am one sitting in front of you. I had a very traumatic C-section, then 2 VBAC births. And alhamdulillah, in the last 11 years, I have helped countless moms with VBACs after 2 C-sections, 3 C-sections, and even 4. Allahumma barik, and 5 as well. I was not their direct support person, but yes, I was part of that birth team, alhamdulillah. So it is possible, not impossible, but knowledge is key. Do not attempt it alone without knowledge so that you are able to make informed decisions. Okay, now back to postpartum. What are the symptoms of postpartum depression? Because this is one of the most common ones. And like we talked about, so many moms, 1 in 5 moms, face them, but then 7 in 10 hide these symptoms, which is sad. So things like intense sadness, hopelessness, emptiness, depressive moods, loss of interest in activities, disturbed sleep, reduced appetite, fatigue, restlessness, guilt, increased indecisiveness, even la samhallah, suicidal thoughts. These, even one of them, is a symptom of depression. And if you are facing this, please promise me the next thing you will do today is reach out to a therapist and book yourself a session and debrief and start your recovery journey, inshallah. I'm going to share, normally I would do quizzes, but because this is a serious topic, I am going to use a professional scale, which I use with my moms who show any signs of postpartum depression. It is known as the EPDS scale, right? I'm going to share the link of it now in the group and in the chat here. I want you all, it's quick, not many questions to answer. I'm going to give you guys 3 minutes to answer it, and it will automatically give you your score. You don't have to share it with me. I respect your privacy. But if you see, it will tell you whether you are in the danger zone or not. I did it today myself again. I was not, alhamdulillah. But if it is telling you that your score is within the danger part, then please note it down and get the right support. Do not ignore it and seek the maternal help that you need. Okay, I'm going to stop sharing my screen. And I'm going to go into the chat, pull out the link, typing it here. Everyone in the meeting, there you go. Plus, I'm going to send it. I'm going to share my screen and show you what it looks like as well. Okay. I'm sending it in the WhatsApp group as well. So. There you go. And let me just share my screen to show you what it looks like. This one. It is the Edinburgh Postnatal Depression Scale. Okay. Screen. And there it is. It has a little introduction about it, and it is done by professionals. Okay. It has 10 questions that you need to answer, right? Just think of yourself for the past 7 days, not more, not 7 years, just the last 7 days, how you felt. Go through each of the questions and answer based on the scale. And this is, as a professional, I use it with my moms, and I've given it to you now. See the score that you get, and once you've submitted it, it will tell you if it's something that you need to intervene in or not. Like I said, this is an awareness event. I'm not individually addressing each person, but for the sake of awareness, you doing this little quiz or using this tool rather to see where you are at with your maternal mental health and recognizing and knowing, do I need to seek support, professional support or not? This is important. Okay, so I'm giving you guys 2 more minutes to go through it. If you wish to share something in the chat, fair enough. If not, up to you. okay? But this is a way to detect and see where you are at, okay? Just the last 7 days, 10 questions. Answer them. Get your score. Take a screenshot, note it down, and see where and how you can get the support that you need. All the birth professionals with me right now, some of you are online. If you want to take a note of this tool and use it, inshallah, with your moms, please do. No problem, Hayati. There are some questions and things. I'm going to get back to all the questions in the chat at the end. Okay, 1 more minute to go. You might be surprised by the answers you get. And please be honest with yourself. Like I said, I'm not asking for the answers. This is between you and Allah subhanahu wa ta'ala. The more honest you are, the more you validate your feelings, the more you will be able to help yourself. And if you want, you can share it with family, friends. If I'm your childbirth educator, share it with me. Message me on direct. You guys know who you are and how I will prioritize you, right? And then let me help you. Take a screenshot of your score and make a note of it. Now, let's continue. If you want to do it again weekly, do it again weekly. Do you want to do it monthly? Do it monthly. Keep a check of yourself. It's a little self-diagnosing tool and use it to help yourself heal. Don't just do it and leave it. If it's saying you need to seek support, seek support. Now, there are two things. So postpartum blues and postpartum depression. We also call them baby blues. Now, this is more common and not as serious, but should not be dismissed, the baby blues, because it is like 8 out of 10 women would feel this. It happens usually right after birth. And it can go away, like it would peak within a week maximum. And by the time the baby is 2 weeks old, it goes away by itself. What do you need to do? You need to take time for yourself. Ask someone you trust to watch the baby. If you feel like crying, cry it out. If you want to talk it out. If you want to debrief it out. There are multiple ways of doing that. Depression, it happens 1 in 10 women, according to this study. And it can persist even for months if left untreated. And it can happen anytime within the first year of childbirth. And this would need, and we talked about the symptoms earlier today, and this would need professional help in the form of counseling. You could just speak to a counselor. Therapy, you can speak to a mental health therapist, or even a psychologist or a psychiatric doctor if you need it. Again, do not suffer in silence. It is treatable. There are many holistic approaches to it as well. Okay, and if needed, medication, then it could be validated also. Okay, because it can take an emotional toll. It can impact your bonding with your baby. It can impact your nursing journey. And that can impact, of course, your child's development. And a baby can sense an unhappy mom. Okay, it can impact your physical recovery as well as emotional recovery, and your immunity would come crashing down if you're not mentally okay. Yes, everything is very much interlinked, and we do not realize that. And I want you to realize that. What can you do? So, of course, like I said, talk therapy, seek support, right? Try to go out daily. Try to do some meditation, some breath work. We'll do some breathing exercises today. Focus on your nutrition. Good food instead of junk, right? This is important. keeping blood sugar levels in balance as well, because if those aren't in balance, then that can impact your mood as well. Prenatal vitamins, best is through food, but doing the right nutrition. So I guide you to tell you that try to take the pregnancy nutrition, continue it postpartum as well. And of course, hydration is key. And then get blood work, lab work done. See, maybe it's a deficiency that's impacting everything. Look through it, dig deep into it, get to the bottom of it, treat it. Because you matter. You are important. Okay, and before our activity for today, I want to address those moms that have experienced infant loss and others. So even if it's a miscarriage, which we know is very common, stillbirth, extremely difficult, infant death, at any point. One of my mamas, she lost her baby who was older than a year old. Very difficult. And then even those couples struggling with infertility, all these things can have a bigger mental health impact, much more than women that are not going through these difficult phases, because these phases that I just talked about right now are difficult themselves and extremely difficult for many. So please do not suffer in silence. Make sure you have support. I have a support group for children in Jannah. Okay? Because remember, a mother's grief is as timeless as her love. I absolutely loved this quote. So all of you here that experienced a miscarriage or a stillbirth or an infant death or facing infertility, just remember, I know that your love is timeless. I know that it's not easy. I'm here to hold space for you. I'm here to hold your hand. I've done debriefing sessions with some of you. At any point you want to reach out, please do. These are major events of life. Don't just brush them under the table. Oh, it's just a miscarriage. You'll just have another one again. No, sorry, no. These are ways to help a woman who's gone through all these. Right? Emotional support. I'm going to read through this. So even the people that haven't, inshallah, faced this, but know people around you that might have, do this. That understanding, empathy, a safe space to express their feelings of grief, sadness, anger, or guilt without judgment. Validate their feelings. It's essential to acknowledge their emotions, not to fix them, as valid, and provide reassurance that they are not alone in their experiences. Give them information and resources that may benefit them from about coping strategies, support groups, counseling services, and even medical options if needed. Practical support. So if you know someone who's gone through this, take care of her, right? Daily tasks, childcare, household chores, something that can relieve her some of the burden. Even if she says no, 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 do it. I'm sure she'll appreciate it because it is a challenging time. Respect their boundaries at the same time, right? If they need privacy or space, don't go, instead just send food perhaps, right? If they want to grieve privately, take their time, let them. Don't judge them. Validation of their parental status. That is why I put it in this slides of today. I spent hours working on this presentation for today, and I made sure to include each one of you. Even if you do not have a baby you're holding in your arms, you are a parent in my eyes. You are a beautiful mother. Regardless of the outcome, you are. You carried the baby, even if it was for a few weeks only. Allah blessed your womb. Okay? Compassive communication. Compassion is what we need. Sensitive language. Let's not use remarks that we hear all around us. Right? Give them du'as. Just be there to hold their space. You might not have answers for them even. And then, of course, long-term support. Right? They might get flashbacks, even if they, inshallah, carry a baby and have a healthy baby later on. The loss is always there. even if time has passed, continue to check in with these moms and let them take the time that they need. Validate their grief timeline. Everyone grieves differently, right? There is no right or wrong. And hope and encouragement. Give them messages of hope, resilience, reassurance that will help in healing and happiness again in future. And my biggest dua for each one of you that have experienced a loss or anything is the Salama dua. What is it? Inna lillahi wa inna ilayhi raji'un. Allahumma ajurni fi musibati wa akhlif li khayran minha. And believe me, I have seen miracles happen with the blessing of this dua, personally as well, not necessarily after a loss. After any calamity, after any hardship, recite this dua with the yaqeen and the intention and see how Allah will open doors. It's a beautiful dua and it's miraculous. Okay, now I told you all to sit with a pen and a paper. So now I want you to take a piece of paper, your paper, or any notebook, and your pencil. I'm gonna give you guys, yes, inshallah, I'll share the group, the dua in the group. I want you to draw your emotions, how you're feeling today. I know it's been an emotional session overall, but I will inshallah end it with some breathing to help release what we've been feeling. So I'm sure we all feel overwhelmed with emotion at this moment. So now I want you to pen it down. This is one form of debriefing, right? Draw your emotion. There's no right or wrong drawing. I'm not going to judge your drawing. You don't have to send it to me. If you want to, you can, right? You can DM it to me if you want, or if you want to share it, you can tag me. That's my handle, Hafsa KQ. So draw anything. You can use both hands if needed. It can be detailed or simple. It could be a scribble. It could be a beautiful drawing. Let your hand loose. Make sure your muscles aren't tensed. Just let them loose and start drawing. Okay? As you draw, breathe deeply. Let your energy flow out through our body, through all these tense emotions, and down to your hand and through this finger and pencil. Don't write anything, just draw. And don't think too much that I'm going to have to focus on the details. Don't. If you want to draw a detailed picture, that's fine. But don't have a blank paper in front of you because you can't think what you draw. Just start whatever's coming into your mind and put it down on that paper. Don't tense your muscles. Don't take any input from outside, even if it's your little one telling you, Mama, why are you scribbling on this paper? Don't do that. Don't hold your breath. Like I said, do some deep breathing as you're drawing. Are we with time? We have some time. So I'm going to give you guys 5 minutes, or let's make it 3 to 5 minutes. And you can type in the chat that you're done after you've drawn. It doesn't have to be a big picture. It doesn't have to be detailed. You don't need multiple colors. Just one pencil and draw something. And then if you want, you can take a picture of it and share it in the group. So start drawing now. Relaxing all your muscles in your arms, in your thoughts. I'm putting it down on paper. Doesn't have to make sense at all. Whatever you feel, just put it there. If it's anger, let that anger on the paper. If it's happiness, put it on the paper. If it's confusion, draw your confusion. So draw your emotion. How do you feel? I'm getting some dones. Well done. If you want to take a screenshot and share it on the group, in the WhatsApp group, you can do that. If you don't want to, that's perfectly fine. If you want to share it with me directly, don't WhatsApp messages are get a bit too much for me to answer every person. But like I said, you see my handle on the screen. You can send it to me on Instagram or tag me. Okay. I'm going to give you guys 3 more minutes to complete your drawing, inshallah. And those of you listening to the recording, if you want to do it later, as you listen to the drawing, recording, you can do it as well. I'm receiving pictures in the group. Jazakumullah khairan for sharing. You're all amazing mamas for sitting through this session, for giving priority to this. I'm proud of each one of you. I'm not sure what it is. It's fine. It is, like I said, doesn't have to make sense. Okay, 1 more minute. Jazakumullah khairan, everyone who's been sharing. And again, it's okay if you don't want to share. I respect that. But it's important that you take and address and acknowledge your emotions. And some of my moms have sent me your scores. I'll get back to you, inshallah. All right. Thank you so much. If you want to continue later on, you're more than happy to do so. Both hands. Thank you. We had a mom who drew with both hands. All right. So the key take homes before we do some little breathing to help us feel a bit lighter. Just remember, taking care of yourself doesn't mean me first. It means me too. And that is how important you are. So please don't wait. Don't wait for things to get worse. Recognize and prioritize. Because remember, no one can serve from an empty vessel, right? You mamas have so much going on. You are responsible for so many things. You need to make sure that you take care of yourself as well. Seek support. There is no harm in it, right? We hear noise around us that mental health therapy, people judging us. Let's change that. You and I, we can change this together, as there are 700 of us in this group that can change this together. Right? To help bring these waves of change. If you and I address and realize the importance of mental health and the importance of mental health therapy, so imagine the waves of change we will bring and abolish this taboo around this topic. And we'll hold a mother's hand and tell her, please take some therapy. Because therapy and counseling can truly help us. And I want each mama today onwards to grow from where you are, to acknowledge your being. You're an amazing mom. You're doing great. Your baby is blessed to have you. All right? You are the best. You're the world in your baby's eyes. Okay? And for the ones that are pregnant or planning for pregnancy, get the right support in pregnancy. These are the classes I do. And the next one's starting on Sunday. And it's the last group until August because I'm traveling next month, inshallah. So there will be no group until August. Okay. So if there is no group until August and you're due, and these classes are over 5 to 10 weeks, right? So make sure, don't wait until the end of pregnancy to educate yourself. Try and take the classes as soon as possible. This is including 20 hours of education. Your husband's more than welcome to join. It includes all the support groups I was talking about, extra resources, exercise, pregnancy exercise videos, nutrition guidelines, recipes, support individually, right? Emotional debriefing as well, which will help your mental health so much. Interactive weekly sessions with me online, live, with my video on, with all these little babies and props that I have next to me, right? That I'm going to be using and showing and educating you all with. And you will have access for a complete year. And then for the VBAC moms, I do include the free VBAC component. And it does have postpartum guidance. It does have a whole handout of 172 pages that can help you. And I do have specially discounted prices at the moment. And it's available in English, Arabic, Urdu. I teach in all 3 languages. And it is the best Islamic faith-based childbirth education program out there. It's the best one. I'm certified from multiple places, as you guys saw, but this is the one I keep coming back to. And there you go. Thank you so much. One of my moms just sent a testimonial in the chat that she can vouch for this class. Can't even imagine how my journey would have been without this. Subhanallah. Jazakallah khair. I'm so happy to read that. Thank you so much for sharing, Maria. It does make a difference. It did for me, and that's now what I'm doing for you, right? And some of my moms are now educators themselves and doulas themselves. It just makes me so proud, right? And these are all the topics that are covered in the classes. So nutrition, exercise, pain management methods, mother's needs in pregnancy and birth, your trusting your birthing instinct, how to make informed decisions, birthing positions, how to shop for the right doctor, stages of labor, how your hormones impacting all this. I'll write your birth plan with you. I'll help you make your birth team, protect your birth environment, how to make your labor easier. We'll talk about complications and common interventions. And then, of course, postpartum breastfeeding and baby care. And like I said, the VBAC component is included for moms who've had even multiple C-sections. Okay. And then aside from that, I do have specialized workshops, and there are a couple of more coming up. One is definitely happening soon. So these are the ones I already have. If anyone wants them, it's already happening. I will be doing in-person workshops in Pakistan soon, next month. Shisma, I have one coming on breastfeeding and traveling, inshallah. So that's the next topic, adding on to these specialized workshops. Okay. So yeah, Jazakumullahu khairan for attending today's thing. So now I'm just going to do a little bit of debriefing, breathing. So breathing out our emotions as we end today's session, and then I will answer all your questions. So just 10 deep breaths. So you're going to inhale from your nose because oxygen is nice and light. So we're going to fill our lungs with some happy oxygen, and then exhale from our mouth while reciting some dhikr, just to exhale and take out all those negative, heavy emotions, right? And get that carbon dioxide out and fill our bodies with the lovely oxygen, which will help us to heal. All right. So a big inhale, nice deep breath, fill your lungs with some air, letting all your muscles relax. And then exhale out, Allah. As you exhale out, become like a jelly. Try to relax one muscle at a time. Nice deep inhale in from your nose. Close your eyes. And then exhale from your mouth. Allah. Nice inhale in from your nose. And then exhale. Rabbi Yasir. Out from your mouth. A deep inhale in. And then exhale out. Inhale in from your nose. Fill those lungs up with this happy oxygen, relaxing all your muscles. Let your fingertips loose. And then, Allah, out from your mouth, subhanallah. Recite the dhikr as you exhale outwards, getting all that negative energy out. 3 more to go. So a nice deep breath in, taking all the positive energy that you felt today, inshallah. And then Ooh, breathe out. Alhamdulillah. Breathe out all that negative energy while you relax your legs this time. Nice deep breath in, all that happy oxygen in our lungs. Our lungs are saturated. And as we exhale out, Allahu Akbar, we relax our arms this time. Last two. Nice deep breath in. Fill, 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 fill. All happy, happy thoughts. And then exhale out. Alhamdulillah. All the negative thoughts that are in our minds. And then the last one. Deep breath in. Imagine a beautiful place as you breathe in. And as you breathe out, Allahu Akbar. Alhamdulillah. Just relax. Now you can open your eyes. And now listen to me as I answer each of your questions. If anyone has a question, the next 5 minutes, I'm going to be answering your questions online. Thank you so much. If you wish to leave, you are more than welcome to leave. Thank you so much, Hafsa, for saying that you feel so heard. This was the purpose of it. I hope, again, I am no one who's perfect. I'm the first person that needs help, as always. I'm a learning person myself, but I really hope that today's session was beneficial for all. I really hope you all learned something, that you all healed a little bit even from whatever that was going on in your mind. I'm just going to go through all these questions here. So someone asked, what if during the pregnancy I feel the sudden urge of depression as self-harm, but it's not directly or superficially related to pregnancy or birth? That urge could possibly be triggered from any past trauma that could have happened. It doesn't have to be related to pregnancy or birth. Do not suffer in silence, right? Address this. The fact that you've recognized this, well done. I'm proud of you. But don't leave it at just at the recognition stage. Address it, deal with it, inshallah. Yes, sadly, women are suffering because they're looked down upon as they express their symptoms or mocked. So let's us women be the support that these women need all around us, for each other, for yourself first. Let's change this. Let's get out of the cultural norms. Let's talk evidence-based. Let's talk religiously, Islamically correct information. Let's give the mom the emotional support that they need. Also, abortion because of less gap between 2 C-sections. I am so sorry that you face this. Inshallah, may Allah again recite the Salama dua. Inshallah, I'll send it in the group. It will help you. Thank you so much. And all these kind words. Alhamdulillah, definitely support groups make it easier. Yes, back-to-back C-section. So if moms need support post C-section or from recovering from C-sections, definitely please get the support that you need. Yes, definitely you can have a VBAC. I'm in touch with a mental health therapist ever since the baby's birth, going through continuous CBTs, but it's not just helping. Maybe change your therapist, right? I'm glad you're taking the therapy that you need, but maybe the change of approach. If you really feel it's not helping, don't just continue with the same thing. Make a change. Okay? Those of you that have faced an infant death, my hearts are with you. You are amazing mamas. Remember, لا يكلف الله نفسا إلا وسعها. These babies will hold your hand and take you to Jannah. Keep me in your du'as, because your Jannah is guaranteed. I need your du'as. Inshallah, these babies are well taken care of. Yes, inshallah, I'll share the dua. Okay, thank you so much. Does the stitches tear if you try for a VBAC soon enough? No. I've had moms who had a VBAC after 11 months of a C-section. Thank you so much. So Sana has shared the dua already in the group. يعطيك العافية. Thank you so much. Even 11 months. So she had a C-section, and then after 11 months, she had a VBAC, and it was all perfect. Alhamdulillah, she was fine. Again, she did not go into it blindly. She did not ignore. She educated herself. She mitigated risk factors. And alhamdulillah, she achieved. So when I educate you, I don't tell you to just go blindly in. Nah, I tell you, I teach you, I guide you, any warning signs, when to make the informed decisions, what are true complications, how to deal with them, and everything. Inshallah, definitely, Mubina. You can definitely have a VBAC after 2 C-sections, inshallah. Is there any reason for preterm spontaneous delivery? A healthy mom with no cervical issues or any prior complications? Depends on any, if there is any history. Sometimes there is no one answer, but working and looking into multiple causes, not just the mom, but even the father, right? So sperm health, the mother's health, all of these things, not just the cervix. So it's a lot more than just the cervix, or any other complications that needs to be looked into and addressed. Thank you so much, Vania. The fact that you're always here in my sessions just means a lot to me. So many of you, mashallah, ya'tik al-afi. Lovely to have you online once again. If some health concerns, is it true that I should avoid conceiving for this reason? Well, depending on what the health concerns are and how they would impact the pregnancy, only then I can give you an answer. But if you know what you have health concerns, and I would address them, I would take care of them, try to, see and heal from that, inshallah. Okay, I answered the VBAC one. Thank you so much, Ubaida. Lovely to see you online, of course. What about necessary abortions advised by doctors? I'm sorry, no. It has to be your decision, not by the doctor's decision. I'm so sorry that you've been forced into something like that. Someone wants to become a doula, so you can check out Amani Birth's website if you wish to become a birth professional. Any other questions? I've answered everything that was asked in the chat today, even the direct messages. Lots of them were direct. So depending on where you are in which country, again, just hiring a doula is a small part of the picture. Make sure you've taken childbirth education classes, because most doulas will not take on a mom who has not educated herself, because no doula can make decisions for you, right? A doula does not guarantee a birth outcome. You educating yourself first is the first step, and then your childbirth educator can be your doula, or she can guide you towards any doulas that are available. Okay. Inshallah. Again, I've left my contact details on the top. And like I said, the next group, the last group rather, in English is starting on Sunday. And then the next one won't be until August, right? So if you want to join these classes, sign up right away. I am not going to limit the number of seats as such, but yeah, please try to register as soon as possible. Okay, and here are the details. One of you just messaged me, this is what's covered in the classes. Okay, this is what I provide additionally. Okay, and my contact details are up on there. Okay, يعطيكم العافية, جزاكم الله خيرا. I guess there are no more questions. I just want to thank each one of you. Thank you so much for being here today. It was my pleasure to have this talk with you. And those of you that are listening to the recording, I hope, inshallah, you find it beneficial as well. Jazakumullahu khairan. Let's recite the closing dua. سبحان الله وبحمده سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. جزاكم الله خيرا. Same here. Amazing to always see you guys and do these awareness topics. Inshallah, hope to see you guys in another event, hopefully in person in Pakistan next couple of months, or online, inshallah, after the summer, بإذن الله. يعطيكم العافية. جزاكم الله خيرا. السلام عليكم ورحمة الله وبركاته.